Thank you very, very much for being here this morning. We're embarking on a journey that I hope will actually bring about the single-payer reform that we're all talking about this morning. I'm Eugene Uphoff. I'm a family physician. I have practiced family practice for 40 years. And I want to tell you that this system that we have is abusive to my patients. We need to change it. How many of you here have ever had any surgical procedure of any kind? A lot of hands. So you may know that we're required as physicians to go through what we call a PAR conference before we do any procedure. PAR stands for Procedure, Alternatives, and Risks. And I think we need to apply that to the healthcare system. What is the procedure? The procedure is to take all of the money that we currently spend in all of the healthcare systems of the world, of the United States rather, and put it into a single source that can be used to pay for the healthcare needs of everybody. That's the procedure. You may be aware that between 1998 and 2008, the average income, the wage for Americans went up 29%. In that same 10-year period, the cost of living, the inflation, went up 44%, and the cost of healthcare premiums went up 120%. So what are the alternatives? The alternatives are to do nothing. About 3 weeks ago, there was an article in the paper that said that in the next year, the top 60 health insurance companies are predicting an average of a 10.4% increase in their health care insurance premiums. We can't afford that. The alternatives are that we will continue to spend more and more money, wasting approximately $600 billion a year on a system that puts money into the hands of CEOs of health plans, to the Wall Street investors, and the pharmaceutical industry. What are the risks? The risks of not doing something, or of just changing the system in a minor way, are that people will continue to die. 10 years ago, the Institute of Medicine predicted that approximately 18,000 people in the United States die every year because they have diseases that could have prevented their death had they had insurance and been treated. They reviewed this last year and felt that approximately 22,000 people died last year because of being uninsured. That is no longer sustainable. That is approximately equal to the deaths that occurred on 9/11 every 2